Since the beginning of time, human beings have searched for ways to maintain health and vibrancy and to ward off disease. As we approach a new millennium, many people are finding themselves drawn back to ancient healing traditions.
I feel that the feet are the foundation of life, and they take us everywhere.
Looking at the foot, it gives a map of the whole body.
So reflexology, for me, is an extremely short, quick route to that relaxation response.
It was also relaxing my whole body. I felt so comfortable, and I slept like a baby.
Many people are now discovering that the solution has always been right under their feet. The beautiful island of Maui, Hawaii, world-renowned for its healing and restorative qualities, is the location for our journey into the timeless art of reflexology. In this program, we'll explore how a centuries-old healing tradition is being used today to balance and harmonize our bodies, to reduce stress and create physical well-being.
Anyone at all is capable of doing this, and the nice part about reflexology is it feels so good.
I have a girlfriend of mine that I sent her to my foot reflexologist. She told her she was pregnant before she even knew.
One day I came in with horrible menstrual cramps, and she started working, and all of a sudden it was as if floodgates opened up. And I said, "Were you just, you know?" And she said, "Yeah, that's where I was." She said, "This is just too amazing."
It's a very, very good way to stay in tune with your body, to know what problems you might be having that need to be looked at, and also to relieve a lot of stress and tension, and just make you feel better generally. I feel much better. If you'd seen me 6 months ago, you would know that you could see the difference.
In fact, the first day when she touched various places on my feet, one place I said, "Oh, that hurts," and she said, "That's your thyroid." And of course I have thyroid disease, so I thought that was pretty interesting. It helped me where nothing else did, and I was very aggressive in trying to find things that would work, and very persistent, and this is finally the thing I believe that really turned me around, and I am continuing to have reflexology, and it will always be a part of my life.
It's one small step for man, one giant leap for mankind.
In a lifetime, the average person walks to the moon and back. Where would we be without our feet? We run, jump, saunter, stroll, tiptoe, sprint, and shuffle. We march, bounce, hike, hop, leap, and tread ever so softly.
We don't go anywhere without our feet.
We can set off on the wrong foot, step on each other's toes, put our foot in our mouth, get our foot in the door, put our feet up, walk in someone's footsteps, put our foot down, get our feet wet, have one foot in the grave, and still land on our feet, all the while remaining footloose and fancy-free. We can do all this, and yet how often do we truly acknowledge our feet? They play an enormous role in our health and well-being. Our feet contain 52 bones.
That's over 1/4 of the bones in our body.
In a typical day, each of us takes 7,000 steps, which adds up to about 7 miles a day. And those 7,000 steps shouldn't be taken lightly. Every step we take subjects each foot to about 130% of our entire body weight. In one day, our feet lift and carry a total of at least 10 cars of coal.
Maybe we should put our feet up more often, or maybe we should just thank them. Thank you, feet.
Since 1973, Ann Galanders has performed and taught reflexology. She's a best-selling author, internationally recognized teacher, and authority on reflexology, and founder and principal of the British School of Reflexology.
When we used to walk the earth on rough ground, we were in communication with the earth every day of our life, And the more we walked on rough stones and twigs and so on, we received this stimulation through our feet, which helped us to keep in good health.
I love to be barefoot, and there's definitely the earth is my mother, and when I walk on the earth, I'm walking on my mother's body.
The foot was not designed to walk on a hard, unyielding surface. The feet were designed to walk on conforming surfaces so that every time your foot would hit the ground, something would come up and fill in. That is, the ground would come and fill in all the concavities on the bottom of the foot. Like if you're walking in sand or earth, you're getting stimulation to the various areas of the bottom of the foot, which you don't get when you're encased in shoes.
Nowadays, going barefoot is not always an option. However, reflexology provides even more stimulating and thorough health benefits.
So what is reflexology? Reflexology is a science that deals with the principle that there are reflexes in the feet that connect to each and every organ, gland, function and part of the human body.
It works on the nervous system, on the central nervous system, which, as you know, is the brain and spinal cord. It has a profound effect on that area from which stress emanates.
So with the relief of stress, which is the main benefit of reflexology, it doesn't just mean feeling better mentally about yourself. It means that when the body is de-stressed, every single function of it improves dramatically.
Reflexology is known as an archetypical form of therapy. No one culture can claim to have discovered it. Since the beginning of time, people around the world have believed that touching specific points on the feet replenishes the entire body. One of the earliest graphic documentations of reflexology can be found in Saqqara, Egypt, in the tomb of Ankh-Morpork, also known as the physician's tomb. This pictograph, dating back to 2330 BC, is believed to depict an actual reflexology treatment in progress. The Egyptians perceived the human body as a symphony of vibrations, the internal organs making up an intricate orchestra. They maintained that these organs could be tuned or played by manipulating points on the feet. Evidence of reflexology's existence can also be traced back over 5,000 years to India, as well as China and Japan. The placement of these sacred symbols on the Hindu god Lord Vishnu's feet correspond to many major reflexology points. It appears that the ancient Hindus believed that the macrocosm of the entire human body is contained within the microcosm of the feet. In Buddhist tradition, Buddha's feet or footprint is oftentimes used to represent his entire being. This may be another allusion to the fact that the entire body is carried within the soles of our feet. The earliest known documentation of Chinese reflexology dates back to the 4th century BC, when it was practiced in conjunction with acupuncture by a doctor named Wang Wei.
There was a Chinese doctor who found that if he applied pressure just to the feet with his thumbs, with the needles in position, tremendous energy was released and healing took place.
It wasn't until the beginning of the 20th century that zone therapy, an earlier form of reflexology, was introduced to the United States.
Dr. William Fitzgerald, who was an ear, nose and throat surgeon, discovered that if you applied clamps to the tips of your fingers, and you used to use little like metal clothes pegs, and then you put elasticated bands around the middle section of the fingers, you could create an anesthetic effect up the arm, shoulder, into the throat, face and head.
Zone therapy is based upon the theory that the body is divided into 10 equal and vertical zones. Applying pressure to one area of a zone could affect all the organs and systems within that same zone. Pressure was often applied to the hands and the feet.
At that time, remember, anesthetics were so dangerous, chloroform masks and so on, and more people died from the effects of the chloroform than the problem they had. And he used to do minor surgical intervention, teeth removal, tonsillectomies, throat surgery, facial surgery, by just this pressure to relieve pain. And in his book, Zone Therapy, he said, when the nerves of the hands and the feet are clearly understood, there will be a tremendous breakthrough in the field of healing.
There has been speculation that Fitzgerald learned zone therapy from Native Americans. For thousands of years, many tribes have employed various forms of footwork to treat pain, diagnose illness, and balance the body. Or Fitzgerald may have learned of zone therapy in Europe, since it was practiced hundreds of years earlier by working classes of Middle Europe, as well as by those who provided health care to its royalty. Dr. Joseph Shelby Riley, a physician during Fitzgerald's time, did not subscribe to the popular medical belief that zone therapy was mere quackery. Riley became an ardent practitioner of zone therapy, further developing Fitzgerald's techniques. During that time, a woman named Eunice Ingham was working as a physiotherapist in Riley's office. It is Ingham who had a truly profound impact on Western reflexology. Before this time, the majority of the focus had been on applying pressure to the hands. Ingham believed that the feet, being more sensitive, could create greater results.
And she produced the charts, the Ingham charts, and discovered that when there was a problem in the physical body, you could match up a painful spot in the foot. And she found it was so accurate. The person had a bad hip, and you apply pressure on the outside, you get this reaction.
Ingham also discovered that pressing certain points did not simply anesthetize pain, but could actually stimulate healing. Dwight Byers, Eunice Ingham's nephew, was one of the first people she tested her methods on. Today, he carries on her work as head of the International Institute of Reflexology. During the early 1970s, Anne Galanders studied with Dwight Byers in England. Today, she is one of the world's foremost authorities and teachers of reflexology. Guidelines. Relaxation techniques.
In order to make it easy to understand reflexology and to make it easier to give a treatment session, it's important to understand the guidelines of the feet, which identify and isolate specific parts of the physical body. The guidelines are divided into 4 major and 1 minor parts. I'm going to show you on the feet how we isolate and identify these special areas. To start with, we have the first major guideline of the foot, which is the diaphragm line, and that's identified by observing the darker colour tinge of the skin above that line to the flesh below, and at that level we draw our guideline across. That's the diaphragm line. It also represents the base of the lung and is a very good area to work in any case when you are trying to relax the lung function. The next major guideline is the waistline, and that's determined by running your index finger along the outside edge of the foot until you find this little bony protrusion called the 5th metatarsal notch. Now, if you're a long-waisted person, this bone will be lower. If you're a short-waisted person, it will be higher. It just goes to show how very individual everybody's feet is. And we then draw our guideline of the waistline across that level there. The next guideline is the pelvic line, and it's found by feeling both your ankle bones and drawing the line together and running a line across the very base of the heel. That is called the pelvic line. The next guideline is the ligament line, the plantar ligament line, and if you retract your big toe and run your thumb down, you can feel this very tight, taut, elastic-like sensation. And on that line, we draw our dotted line to identify the ligament line. The 5th minor guideline is the shoulder line, and that's identified by coming just a ½ inch below the toe areas and drawing your dotted line across this space. All the reflex points in the body are found above or below or on the inside or outside of those major guidelines. Before you commence giving a treatment to your friends or loved ones, make sure that they're in a very relaxed reclining position. As we see here, this is the ideal situation to give a treatment. It's very good and essential to apply a little light talcum powder to your hands and the soles of the feet of the person you're about to make contact with to make your job much easier. I'm going to teach you now some nice relaxation exercises to get you used to handling people's feet. And the first one we call relaxation exercise, side to side. And by cradling the 2 hands either side of the feet, we give a nice moving effect And if you're doing it right, your foot should flap from side to side. Do exactly the same technique to the left foot. It will loosen up the stiff foot and make it much easier to start working upon. The second relaxation technique we're going to use is the diaphragm relaxation. We're going to put our thumb just below the toe bones, as we see here, and we're going to pull the pressure of the toes over onto our thumb. We're contacting the base of the lung here, and the benefit of this is that it does slow down the respiratory rate and put the body into a nice, fine, sleeping mode. So don't be surprised if your patient very quickly nods off to sleep. So we work from the inside to the outside of the foot and then return. The next exercise is called metatarsal kneading, and making a fist from the sole of the foot and placing our hands on the upper part. We push in and retract back. It's very much like kneading bread. It's a very special one, a favorite, metatarsal kneading. Then we're going to do a nice exercise to loosen up stiff ankles. This is really good for elderly people who perhaps have arthritic constriction, and it helps improve the mobility of their feet. So placing the thumb joints in front of the ankle bones, we will rock the foot from side to side. And that's called ankle loosening. We're now going to do a rotation of the foot, so placing our left hand underneath the right heel, like we're showing you here. We're going to turn the foot in a nice oval direction. And that's called the undergrip. And then we're going to place the hand over the top of the instep, and that's called the overgrip rotation. We repeat exactly the same techniques to the left foot as we do the right. The next exercise is called the foot molding, and sandwiching the foot between the palms of both our hands, we do a nice movement across the foot. This frees all the bones of the toes. It's a nice relaxing exercise for the upper part of the foot. Foot molding. And last but not least, we work across the rib cage, making pressure contact from the sole of the foot. We creep nicely round the fronts of the feet with all the four fingers joined together of both our hands. And that's called rib cage relaxation. And that's a conclusion of all the relaxation techniques which you can use to start your treatment, use some in the middle and some at the end as a final aid to healing the body through the feet.
The body is comprised of 10 major systems, and they can all be found on the soles of the feet. The respiratory system.
The respiratory system comprises two lungs and a trachea, which is the airway that brings oxygen into our lungs. Our lungs are cone-shaped and lie in the upper thoracic cavity, the right one being larger than the left. Each lung is filled with millions of alveoli, which are small air sacs which control the exchange of gases. The exchange of gases means bringing in of oxygen and elimination of carbon dioxide. The most common complaints that we can associate with respiratory problems are bronchitis, asthma and emphysema. Bronchitis is said to be the Western disease, subjected to there being so much intense pollution in our environment today. So when we look at the feet, we can go on to looking at the lung area on the right foot, and we would find this by working on the upper section of the foot, and we work the lung area by holding the toes back and away from us and nicely working up these spaces between each of our toes. So we work from the very base, underneath the metatarsals, to the joint of the toes to the foot. This is the area that is responsible for the whole of the lung on the right side. Asthma is very prevalent in children today, a lot again to do with pollution, and children seem to respond admirably to reflexology. Maybe it's because their vitality is a little higher than ours as we get much older, but they certainly seem to have good results within a very few months. And many children have been able to come off their Ventolin and their nebulizers, or at least reduce them to a much lesser degree. We can also find a contact point for the lung area on the front part of the foot. It is the area just below the metatarsal bones. And we work this by applying pressure from the sole of the foot and working down between these grooves with our index finger. So this is the lung area and the breast area on the front part of our foot. Just as organs and functions overlap in the physical body, so therefore do reflex points in the feet. So the breast area is on the upper part of this point and the lung just beneath. If we go over onto the left foot now, we're going to be contacting the areas to the left lung, and we're going to work exactly the same procedure from the base of the metatarsal joint up between the area of the toes, using our left thumb this time, and supporting our foot and holding it out as I'm showing you here. Again, from the base to the top, base to the top, and returning and changing to our right thumb and going back over the same reflex points to give extra stimulation, extra work. Most people get a good reaction to an improvement in their asthma within about 6 treatment sessions. Again, we can contact the front part of the lung and breast area by making a fist and working down the grooves between each toe. Just go down about 1 inch, and that will cover that whole entire area of the lung and the breast on the front part of the foot. Coming back from the lateral side, working down between the grooves until we get back to the beginning of the treatment on that left foot. This therefore is the whole area that we would work on for helping respiratory infections of the lower areas of the lung.
Presidential reflexology. Following an assassination attempt, President Garfield, America's 20th president, suffered from extreme long-term pain. When all other remedies failed, he was able to alleviate his pain through intensive foot massage. The circulatory system,
the heart is a muscular pump which deals with the propulsion of oxygenated blood through our entire body. And without oxygen reaching every single cell, we would very quickly die. The heart's a great centre of emotions and feelings. We talk about heartfelt good feelings to our friends. We have a broken heart. We are cold-hearted, we are hard-hearted. And the solar plexus is an area just below our lung, which is on the left foot, which is an identifying area to how we feel about ourselves and how we feel about our lives. So the heart is on the left side of the body, and it starts its beating life on the 16th day of your conception and can continue through till you're 100 years of age. There is really no other pump in living memory that could ever fulfill that amazing feat of achievement. So when we look at the foot, we're looking on the left foot because the heart is on the left-hand side of your body, and the sorts of illnesses we're going to be able to relieve and improve are angina. It's excellent for those just suffering from a heart attack. The remedial principles of it give them great benefit, relax them, make them feel better about themselves. It's also good for hypertension, which is high blood pressure, and low blood pressure. So most of the illnesses subjected to propulsion, which is propulsion of blood through the body, will benefit with reflexology treatments. In order to work out the heart area, we're going to work out the area of the first 3 toes on the left foot, beginning with the big toe and ending with the third. So it's just this circumference area around here. And the solar plexus lies just below that left foot, which again is a great barometer to your feelings. So to work that out, we're going to hold the foot in the way I'm showing you here. Using your left thumb, we're going to work across the area with straight lines, reaching out just to the third toe. 1 and 2, covering the whole surface area. Hardening of the arteries, or arteriosclerosis, which is a very popular westernized disease today, can be relieved and hopefully prevent further problems occurring. So it's well advisable for people who have had a heart attack to have very regular reflexology treatments for the rest of their life. If only conducted over a monthly session, it will certainly be of benefit and again help them possibly not to get into trouble with their blood pressure and their angina attacks again. We come back from the lateral side to the medial side, covering that whole surface area. If you've just recently had a heart attack or are suffering from corrosion of the arteries, you're likely to feel quite a lot of sensitivity in this section of the foot. But persevere with this, and if you can help your husband or friends or family on a daily basis just following a heart attack, their recuperative state and the convalescent stage of their illness will be greatly enhanced.
The lymphatic system.
Your lymphatic system is a system of immunity, and throughout the main prime areas of the body, which is the neck, the armpits, the breast, the intestines and the groins, we have small nodes called lymph nodes. These little nodes contain lymphatic fluid, which is still a part of your circulatory system. And rather than being propelled by the pumping of the heart, it's propelled by movement, by gravity. So as we walk, we distribute lymph fluid throughout our physical body. The main area of the production of the immune system of the white blood cells is on the spleen, which is found on the left side of the body and therefore is on your left foot. The spleen produces millions of white blood cells by the hour. It is our defense mechanism. However, when we're very stressed and very strained, the first area to be defective is the immune system, which is why a lot of people who've been suffering from all sorts of anxiety states, depression, maybe bereavement, tend to have a low immune system and frequently succumb to some very unpleasant illness when their partner or friend has died or when they've nursed someone through a very serious illness. Now, the lymphatic glands are worked primarily over the main parts of the feet, so we're going to work at the very bases of the big toe, which would contain the lymph nodes in your neck. So if you had tonsillitis, your lymph nodes would swell in an attempt to prevent the infection arising and going further into your brain, whereby you could succumb to the unpleasant illness called meningitis. The second area of lymphatic drainage and lymphatic support is in the breast area, and it's on the front side of the foot, and it's all the lymph nodes in the breast spaces. So it's found and contained within the first 5 toes. And to work that, we work exactly as we did when we directed our pressure on the lung area. We work down in between these little grooves of the feet, and we're contacting the lymph nodes in the breast area here. The 5th one is just out there. Again, the lymphatic glands in the spleen will be found on the left foot because your spleen lies on the left-hand side of your body. It's often a very sensitive area if you've recently had a severe infection. But to help the immune system and get it to work more efficiently, we can work out this area from the lateral side, working right out to the side of the foot. Continue with the pressure from your thumb, just working on this outward direction. It actually is in line with the 4th and 5th toes. So we have a few scattered lymph nodes in the liver, which is just along the area here. A few scattered ones in the intestinal area. And we have a lot of lymph nodes in our groin, which is the area just around the top of the instep of the foot. So that these lymph nodes would become very sensitive if you've been travelling a long distance or been travelling by aircraft and have got tense, swollen legs. This is a prime area to work to reduce the swelling caused by flight or travel of any sort in the leg areas. Working out this area 3 or 4 times will very quickly reduce the lymphatic pressure which is built up. And the same applies exactly on the left foot. We have lymph nodes, again, a few in the intestine, which is across this area here. And also on the left foot, containing the areas to the left leg. If you had swollen feet or legs because of travel or an illness, you would work upon this area here to reduce the fluid retention in your leg and foot areas. Continue working this space 5 or 6 times to get the maximum improvement. And a nice little rotation will take the pressure out of the legs when fluid has been built up there for some hours, and very quickly you'll see the legs return to their normal shape and size.
The history of shoes. Throughout history, shoe styles have varied tremendously, as this collection from the Shoe Museum at the Pennsylvania College of Podiatric Medicine demonstrates. The first universal foot measurement was created in 1320 by King Edward II of England, when he arbitrarily decided that a unit of measure would be a foot. His foot. It wasn't until the time of the Civil War that shoe history took another great leap forward, when shoe manufacturers began making left and right shoes, rather than identical pairs. The digestive system.
We're going to talk about the digestive system. The main organ, the greatest function of that would be the liver, which is the largest organ of digestion, found on the right foot. And the main principle it has is to detoxify the waste from the body. It also produces and stores vitamins and controls the heat level. We have the intestinal area on the right foot too, starting with the ascending and the transverse colon. And going over onto the left foot, we find the stomach and the pancreas. Now the stomach is a reservoir for food. It has a lot of initiating substances such as hydrochloric acid, and they neutralize the foodstuffs and distribute them throughout the body. We also have the transverse colon on the left, the descending, the sigmoid and the external bowel. So the intestinal area is really involved with the absorption and elimination of food. And without this principle, we're going to become very toxic in a short state of time. The Western world suffers from constipation. It's the Western disease. And we also have more bowel conditions than ever before. And these are all mainly due to Western living, stress, and Western diet. So the areas we're going to work on in this particular case would be all the liver area to start with, which will be found on the right foot. And we're going to work this area out from the medial to the lateral side, using these very, very tiny forward creeping movements with our right thumb. We always go forwards, we never return or go backwards, and we don't use circular movements. It's always an ongoing forward pressure movement. Is that pressure acceptable to you? It's not too uncomfortable. Good. Reflexology should never at any time cause the patient to withdraw their feet in discomfort. It is supposed to be a relaxing therapy, and if too much pain is created, the tension levels build and the whole treatment is void. Now we're going to go over onto the intestinal area, and the beginning of the large intestine at the base of the foot is called the ileocecal valve. We do a nice hooking out technique to this one, and that's a very good area to help chronic constipation and also any mucus accumulation, which sometimes happens in the bowel following an infection. Then we're going to work the whole of the transverse colon, which is across the midline of the foot, from medial to lateral, going right out to the outside edge, keeping your lines nice and straight and descending right down into the very base of the heel. Reflexology is excellent for all bowel conditions. Irritable bowel syndrome, constipations, Crohn's disease, to name but a few. So we're going to change our thumb now and support the foot with the right hand, and we're going to use our left thumb and work from the lateral edge back to the medial side. This is again all the large and all the small intestine. Now the small intestine is the area in the body that absorbs the nutrients from our foods and processes them back into our bloodstream. So the large bowel is the eliminating feature and the small bowel is the absorbency part. These feet are nice and mobile and there doesn't seem to be any major sensitive spots, so I think that Jennifer's health at this time is very good. Then we're going to go over to the left foot and repeat a very similar process here. We're going to be working on the area from the midfoot to just below the metatarsal bones again. And this time the left foot represents the stomach and the spleen, because your stomach and spleen are on the left side of your body, so like for like. So we're going to start working with our left thumb, holding the foot in a nice outward direction, and working from the medial to the lateral side again with these very fine, small, creeping movements. The stomach reaches right high up into the toes, the bone space just below the toes there. And we're going to return and do exactly the same procedure, working from the lateral edge, coming back to the medial side. From right to left and then left to right. To contact the corresponding part of the transverse colon, which is the large bowel, we're going to have a heel support with our right hand. We're going to use our left thumb and we're going to work from the medial to the lateral side. So we'll contact the major large bowel, the descending part of the colon, and that is the part of the bowel that normally gives rise to constipation and irritable bowel syndrome. It's far more common to get more inflammation on the left side because of the deep curves of the bowel than on the right. So we're continuing working all the way down to the very base of the heel. Is that all right for you? Not too many? No disaster areas either. Very good. The increase of all bowel disease today is diet related. So watch what we eat. Lateral to medial, now coming back, using our right thumb this time. Nice forward creeping, stepping movement, covering every little tiny part of this foot, because that one spot you may leave out may be the very part that needs working upon. And then the treatment becomes non-effective.
The psychology of feet, bearing our souls. Renowned therapist Carl Jung believed that the foot actually represents an archetypal phallus, whereas Sigmund Freud, the father of psychotherapy, believed that the shoe represents a woman's most intimate parts. Together, Freud and Jung would have made a perfect pair. The sex life of the foot and the shoe is even showcased in one of our most popular fairy tales, Cinderella. 17th century author Charles Perrault originally intended it to be a romantic, if not erotic, story for adults. However, Perrault's scribe miswrote a key word. So instead of slipping her foot into a highly evocative slipper of fur, sweet Cinderella put her foot into a slipper of glass, and the children's fairy tale was born. The reproductive system.
The reproductive system comprises the uterus, 2 ovaries, and 2 fallopian tubes in the female, and the prostate, vas deferens, and testicle in the male. The female reproductive system is primarily there for procreation, and therefore the ovulatory secretions carry on from puberty until menopausal age. The sorts of illnesses we associate with the female are menstrual disorders, infertility, menopausal discomforts, and fibrotic cysts. In the male, the main cause of problem is testicular cancer, which is on the increase, and enlarged prostate conditions, which we have already really talked about. So looking at the feet, because the uterus is a central organ, we find a little bit of it on the right foot, on the inside edge, and a little bit of it on the inside of the left foot. Anything through the center shares its space. The ovary is found on the lateral part of the foot, exactly between the ankle bone and the tip of the heel, a spot just there. And the fallopian tube joins the two areas together like a bracelet around the upper part of the foot. So we can be very successful in helping infertility, endometriosis, which is an exaggeration of the lining of the uterus, and any menstrual or menopausal dysfunctions. To work the uterine area in the female, we hold the foot in the outward direction, and with our index finger, we work directly upwards towards the ankle bone. Here we go, 1 and 2. We need to take about 3 areas for that. We work the ovary area. We do exactly the same procedure on the lateral side of the foot, and with our index finger, we work up the ovary area. Again, 2 or 3 times, we should repeat that procedure. To join those 2 areas together, we start at the very low spot of the heel and work across the top of the instep, joining the uterus and the ovarian area together, making like a bracelet across the front part of the foot. To repeat that, we're going to work on the left foot once again. So again, to work the uterus area, we hold the foot in the outward direction, use your index finger and work upwards towards the ankle bone. We're going to do 3 times across that area, 2 and 3. And then on the outside of the foot, we have the ovary area, and we're going to again work that area, 1 and 2 and 3. If you have ovulation appearing, or you're about to appear, you'll find a sensitive reaction in the side of the ovary that is ovulating at the time of the month. Again, we join the 2 reflex points, the uterus and the ovary, together by making a bracelet around the top of the instep. Many people have found that reflexology has in some way regulated their hormonal functions, and they have produced a baby, many of whom have been childless for many years. So I would certainly think that if people are having trouble that way, before they go into all sorts of sophisticated treatments which require a lot of drug therapy, give reflexology a try. It's amazing what it really can do for all manner of illnesses and conditions in the body. The prostate gland in the male is found on the insides of both your feet, and we can isolate that area by providing a little measuring technique. If you put the 3rd finger on the ankle bone and the thumb on the tip of the heel and draw your mid finger in line with it, you'll find the prostate gland reflex just there. You'll find a little bit on the right foot, again, and a little bit on the left, because it's a centralized part of the body. And to work this area, we hold the foot in an outward position, and using your index finger, work upwards towards the ankle bone. If you work about 3 times along this area, you'll find it very beneficial in reducing the congestion in the prostate gland. The testicle area is on the lateral side of the foot, again midway between the ankle bone and the tip of your heel, centralized area just there. And to work this area out, we again work up that area to the tip of the heel. In this nice, firm, creeping movement. The vas deferens join the 2 areas together, very much like a bracelet over the front of your foot. And to work those areas, we continue with our fingers together and travel round the front of the instep, creeping round to form just like a bracelet structure around the front of your foot. Make sure you don't overlap the fingers as you do that, otherwise you'll pinch the skin. but just end your treatment with about ½ an inch gap to spare. Going over to the left foot now, we're going to do exactly the same procedure. We're going to work on the prostate area on the left foot, holding the foot out and away from you. You're going to use your index finger and continue the work traveling up this area in line with the ankle bone. Use about 3 areas just there. And then turn the foot to the outside and work the testicle area, which is on the lateral side of the foot, again midway between the ankle bone and the tip of the heel. We can join those 2 areas together as we're doing here. If any male patient has suffered or had a vasectomy operation of recent years, you're likely to find a great sensitivity in this area of the foot.
Feet and sex. Playing footsie with your soulmate. Did you know your foot has a sex life? Many people find the foot being so sensitive is a highly erotic place on the body. In Indian love-making practices, there's a famous toe kiss in which a woman kisses a man's big toe. And according to sex researcher Alfred Kinsey, the toes of most individuals become curled or spread when there is erotic arousal. The endocrine system.
The endocrine system is a system of glandular secretions, chemical messengers they are, and they're conveyed from the master gland in the brain called the pituitary. This is a tiny gland just the size of a pea, but it activates all the main functions of the physical body. So we hear a lot about hormones today. We hear about terrible problems with teenagers who are having hormonal growth spurts, which cause all sorts of dysfunction in families. Then we have the hormonal imbalances in our menstrual years, which give rise to all sorts of concerns there. And then towards the latter part, we have more problems with hormones when we reach the menopause. So reflexology does a great job in balancing the hormonal outputs of the body. So therefore, whether you're treating teenagers, menstruating females, or people in their later years who are at the end of the reproductive cycle, you can still gain great benefits from this. So the pituitary in the brain is found on the side of the big toe. We have a little bit on the right big toe and a little bit on the left. And that is the main prime target area that we should work upon frequently when we're trying to regulate hormonal functioning. The thyroid gland is the next gland, which is in the base of your neck. And we all know about those lucky people who can eat just whatever they like and remain rakishly thin, and the other sorts who have to eat very little without gaining monstrous amounts of weight. And that is due to the metabolic rate, which is indicated here in the thyroid activity. So if yours is overactive, you will be the lucky one, and if it's underactive, you'll be struggling, constantly being on diets. And the thyroid gland is found on the base of the first 3 toes, at the back and at the front. The next main interesting gland is called the adrenal gland, and that really is the flee and fight reactive gland. The ovary, which was on the lateral side of the foot, we've already talked about and worked upon, and that is the youth gland, or so they say, which produces estrogen and testosterone and is supposed to keep us young forever. So during our menstruating years, we're far less prone to all sorts of circulatory illness because estrogen keeps the arteries healthy, gives a gloss to our skin and our hair, and keeps us predominantly in good health. So therefore, after our menopausal years, when our ovaries are no longer functioning, we're much more prone to coronary artery disease and strokes. And the statistics say that we gain the same level as the male does once we get over 50. So to help these areas, these target areas for the hormonal reproductive areas and balancing our hormonal systems, we need to work first the pituitary gland. So we need to make a fine movement up the inside edge of the foot. Remember, the pituitary gland is behind your nose. So that nostril point that we worked on earlier in this video, we're going to repeat that once again, remembering that as organs and functions in the body overlap each other, so do reflex points in the foot. So we can work 7 or 8 times up this area of the right side of the pituitary. And then we go over onto the left foot. We're going to work very slowly and carefully over the pituitary area on our left side. When we go to the thyroid gland, we're going to work it at the base of the first 3 toes, which is the thyroid and the neck area. Again, a dual area. We're going to work the first 3 toes to try and normalize or stimulate, where necessary, that function of the thyroid gland. 1, 2, and 3 on the right foot, and again the base of the first 3 toes on the left foot. The adrenal glands are found on the medial side of the foot, just this area here, and the adrenal glands primarily are there for the flee and fight reaction in your life. So when you lived in a cave and your prime concern was to fight off a wild boar, you need a lot of adrenaline in your veins to activate that function. Today, however, in this rather stressed Western world, most people have a very sensitive reaction in their adrenal gland. So if you want to calm somebody down, you certainly don't need to work that area out there. It's very good, therefore, if you're feeling very lethargic and are suffering from loss of energy, then the adrenal reflex point would be a good target point to work upon.
Fashionable feet. Because if the shoe doesn't fit, wear it. 80% of all Americans and Europeans suffer from foot defects caused by wearing shoes. And the majority of those suffering are women. Women have one inventive female to thank for this, Catherine de' Medici. When this 16th century daughter of a Florentine family moved to France to wed Henry II, she brought several pairs of shoes, specially designed to make her taller. Her high heels became an instant sensation. Women began wearing heels so high that they had to use walking staffs and be carried up and down stairs. And despite high heels' very obvious detriments, they remain extremely popular to this day. The urinary system.
The urinary system comprises 2 kidneys, 2 ureter tubes, and 1 bladder, and the urethra, which is the exit. And the kidneys are there to detoxify and purify the blood. Without their prime function, you will become uremic, severely poisoned within a few hours. The main conditions that we can help with reflexology are cystitis in the female, which is the inflammation of the bladder, nephritis, which is an inflammation of the kidneys, prostate enlargement in the male, which has great benefits. We've also been able to give good results with people suffering from kidney stones. So when we look at the foot and the reaction to the feet and the matching of the body, because the bladder is in the central line of the body, the central dividing line, we find that the reflex points to that on the inside of both feet. So we have half the reflex to the bladder on the right and the other half on the left. So in order to start working on this, we work in line with the ankle bone, this puffy area here, just work up and around that section, work up the ureter tube, which is on the medial side, just behind the spinal area. We cross over and work up towards the kidney space there. Work out the area 2 or 3 times. As the kidney function is normally very sensitive in most people, and that in turn is really due to a lot of caffeine in the diet, alcohol, and various additives in our foodstuffs today, the kidney reflexes are normally quite sensitive in most people. And so in order to work that out effectively and cause as little sensitivity to the patient as possible, we do a nice firm rotation. So applying the pressure with the thumb on the point, we turn the foot inwards, and that works the kidney out, but is much more comfortable to the patient concerned. We repeat the same procedure going over to the left foot, where we have the second half of the bladder reflex, which is just here. And we're going to work up again the ureter tube, cross over into the kidney space, work 2 or 3 times over that kidney area. And again, firm pressure on the point and nicely turn the foot in an inward direction. It's quite an easy way to work this particular section of the body and very beneficial for elimination purposes as well. The prostate in the male is on the inside edge of both feet. It's just there. And a lot of males at the age of 40 or just above get enlarged prostate conditions. It's very common. This will give them retention of urine or frequency of urinating, particularly at night. And we have found during our treatment sessions that frequent working on this particular area can relieve the stress of this condition. In fact, many patients who've been booked for surgery have never had to have it. The way in which you find this particular point is exactly midway between the ankle bone and the tip of the heel. If you draw your mid finger in line with it, it's exactly in that space, centralized. So we have the finger on the ankle bone and the tip of the heel, draw the mid finger in line, and the prostate gland is found just there. And a nice way of working that is to put the finger on that space and turn in the direction, the inward direction of the foot. And that again works the prostate area. We repeat exactly the same performance to the prostate gland on the inside of the right foot. Again, by putting our mid finger to isolate the point, and underneath the heel, support, put the mid finger on the point and nicely rotate the foot, retaining the pressure of that point with your finger.
Soul to soul, sacred feet. Many cultures and religions agree upon the sacred nature of the spiritual teacher's feet. It is the feet of the spiritual teacher, be it a saint, a particular god, goddess, or prophet, which are singled out and revered more than any other part of the body. This may be because the feet of spiritual teachers represent transcendence, their footsteps supposedly showing the way to truth, to enlightenment. According to Buddhist tradition, when Buddha was first born, he was able to walk instantly, lotuses appearing under his feet. Both Hindus and Buddhists believe that lotuses oftentimes represent energy centers or chakras, which run throughout our bodies, connecting us to one another, to the entire universe. It is believed that the chakras located on the soles of the feet connect us with the energy of the earth. The skeletal system
The skeletal system comprises the bony structures of the body, and it's a system of levers, long bones, and vertebrae. We have 7 cervical vertebrae, which are found in the neck, 12 thoracic, which are found below that, and 5 dense vertebrae, which comprise the lumbar area. We also have a very base bone called the coccyx, and this little bone was reliable when we had a tail and walked on all fours. Today, because we're upright and walk on 2, the little bone at the base there is becoming lesser and more fragile. There are lots of associated back conditions which reflexology can do quite amazing results with. I would think the most common condition is sciatica, which is normally caused by a lumbar strain or degeneration of the bones in the lumbar vertebrae. Another common area of the spine to be affected is the neck, and cervical vertebrae are responsible there for whiplash injuries, arthritic necks, and so on. We also have our shoulder girth, where people get frozen shoulders. Our reflexes to our knee are found in that area, and also our hip and pelvic structure. So the main areas that we will work upon when we work on this spine will be the inside edge of both our feet, because the spine's a central area in the body, and therefore the area in the feet link exactly in the same space. The patient we have before us is Jim, and he has a lot of problems in his lumbar spine area. He's been suffering from this for several years, I believe. And when we work upon his feet, the main areas we would concentrate on would be the low part of the spine. So we will start working on the feet by first of all loosening up the very base of the spine, which is called the coccyx area. Holding the foot outward, we use all 4 fingers around the inside edge of the foot. This loosens up the area to the coccyx. For hip and pelvic conditions, we work on the lateral, which is the outside edge of the foot. This is a very good area for hip conditions in elderly people, for degeneration of the hip, and has been very helpful in relieving the pain when people have arthritic hips that need replacement. So prior to surgery, we've done a lot of good work there. So when we start working up the spine, we work on the base area here, on the very inside edge of the spine, and we start working with these small forward creeping movements until we reach about the midline of the foot. And at that point, we bring our fingers over on the instep and we continue working up the spine, like we are doing here with these very fine forward creeping movements. You'll find there's been a reaction in this part of the spine due to the wear and tear which the patient in front of me has been suffering. So when we get to the top of the spine, we use our index finger to work out these very fragile bones of the neck area. And again, we get a reaction there, so you've obviously got neck troubles as well. So we're going to continue to work out this spinal area here. We'll then go over onto the top of the big toe, which is the brain area. This will be quite a sensitive spot in any patient who'd had a head injury. And then we'll work down the lateral sides of the first 3 toes, which is areas, again, for all chronic neck conditions. This is especially beneficial to those suffering from a whiplash injury prior to a road accident. Work round to the bases of the very last part of the 3rd toe. We move over onto the lateral side of the foot, and on the lateral side here we have the area to the shoulder, both back and front, and we work this area out using our thumb, and just flowing out to the outside edge of the foot, this very fine movement like we're doing here. Coming back, we return and work again the shoulder girth. If you had a frozen shoulder, you would have a great sensitivity just here when you were working on this with your friend or your patient. If we run our index finger along the lateral side of the foot till we find this nice little bony protrusion called the 5th metatarsal notch or bone, it is at this point that you can determine the area to the knee and the elbow. And we work this area out in this triangular shape using our index finger. So here would be a very good area to work if you were treating tennis elbow, knee problems, damaged knees from exercise or sports injuries. Would be a very powerful point to work to relieve swellings in the joint, restriction of movement. Continuing down to the lateral side of the foot, we now find our ankle bone, and around the outside edge of this area here, we have the link to the sciatic nerve. Now, sciatica is a very disabling condition which puts a lot of people away from work for many months at a time. It can go on for months, and we use our index finger to work around this very fine area of the sciatic nerve. We need to work up the leg for at least 3 or 4 inches, and in acute cases of sciatica, the sensitivity will be found continuing this far. So we need a nice fine movement along here. So this is the sciatic nerve that descends from the hip down the sides of the leg. And the secondary sciatic point is the area in the buttock, which people suffering from sciatica will know that when you have sciatica, it stretches across the buttock in a spasm and also down the leg. So this area at the very base of the heel is the area for the tension in the buttock area here, and we're going to work along this point with our thumb, like we're doing here, 2 or 3 times. So when we go to the left foot now, we're going to do the same procedure by freeing the very base of the spine, which is the coccyx and the sacrum, and then the lateral side of the foot, which links to the hip and pelvic area. And then we're going to continue working up the spine, starting with the lumbar area, which the patient is reacting to, because that is the area of his spine that is under some duress. We're going to work up the thoracic spine, holding the foot nicely firm and out and away from you until we get to the very top of the spine, where we're going to use our index finger to work the cervical vertebrae. Again, another sensitive spot, which is obviously a lot of wear and tear in your neck area, I would think. Top of the head is the top of the brain, so if you've had any injuries to the head at any time, there could be quite a strong reaction there. And we're going to work down the lateral sides of the first 3 toes, which is the area for stress in the neck, whiplash injuries again, arthritic congestion in the neck. So 1 and 2 and the 3rd toe. To conclude that treatment, we would work out the shoulder area as we did on the right, the knee and elbow area, again as before, and work up the 2 major sciatic areas, which is up the outside edge of your heel area there, and also the very base of the foot, which is the secondary sciatic area. That would really conclude how you would work the skeletal system.
The brain and fascial system
The brain is really like an enormous computer. It's the most amazing at the amount of energy and activities it performs throughout every day of your life. The greatest scientists of all time still can't work out certain features of the brain. How does the brain think? Nobody yet knows that. Where does the perfume come from in a rose? Nobody knows that too. Everything we do in our life begins with one thought. The greatest creation of all time began with somebody thinking about amazing painting, a piece of art, a piece of music. Somebody thought about something. Even the greatest wars, it was somebody that wanted something that somebody else had that started the thought process in action. So when we think of the brain as a computer, we must also think of it as the conveyor to messages throughout our central nervous system. And there are some very unpleasant illnesses which are caused by degeneration of that amazing function, such as multiple sclerosis, Parkinson's disease, and motor neurone disease, which we can still try and give some help with, even if not very much. The biggest dilemma or distraction of the brain is when we have a stroke, which is an eruption of a blood vessel in the brain. Provided we can get to the sufferer within a very few hours after the accident has occurred, there's good hope that we may be able to do something with reflexology. The brain is found on top of the big toes on the right and the left feet. It sits just this area here. And the central nervous system is the spinal cord, which conveys its message from the brain right down to the lumbar spine. In fact, the spinal cord completes its exit at the second lumbar vertebrae. So in order to help multiple sclerosis, motor neurone disease and similar, we again need to work up this area of the spinal cord, reaching up then into our brain stem. If you have had a cerebral vascular accident, which is a stroke, you're likely to find a lot of sensitivity in the top part of one or other of your big toes. Very rarely do people have a double-sided stroke. So if it's the right, we must work along the right side, and if it's the left, repeat the whole performance, working the spinal cord right up into the central nervous system. Reflexology is also very good in helping illnesses such as neuralgia, pains in your teeth, congestions in your face, and the area for the facial exits are the fronts of the big toes and the second and third toes. And to work those areas, we apply pressure from behind and proceed with the index finger and just work out the surface area below the toenail to the join of the toe to the foot. If you have problems with your teeth, you're likely to find a lot of sensitivity on the third toe. If it's the top teeth, you'll pick up the sensitivity just below the toenail. If it's the lower molars, you'll find the sensitivity at the root of the little toe on the third exit just there. So the same would apply to the right side of the face. The facial area would be found underneath the toenail, with the big toe just there, and that would be responsible for neuralgia and any facial pain. Teeth, the areas to the teeth are more likely to be found on the third toe, which is just here. Reflexology has therefore proven to be very successful in relieving problems with your teeth, although nothing is as good as going to your dental surgeon and having the problem sorted out professionally.
Reflexology for babies.
Right, you can see on the baby's foot you don't have any arch support. The foot of a baby until it's about 4 is like an oval. So we haven't got the guidelines in that we would use for an adult. So to relieve problems like digestive problems, colic, teething conditions and general crankiness, if you just use this very forward creeping movement, right from the sole of the foot right up to the top, you'll find it does relieve a lot of the conditions and makes them much better tempered. Nice firm lines right up the foot. From the heel, forward, small little creeping forward movements. And I had a young baby I treated for friends of mine who had 6 weeks of sleeplessness with a newborn baby, and everything they tried, the book said, the only thing that restored their marriage and her to sanity was reflexology. So here we are in this beautiful whaling town of Lahaina, looking at this wonderful banyan tree which shades 2/3 of an acre and is 1/4 of an acre in circumference. And what looks like extra trunks is actually extension of its roots, from which it receives sustenance from the earth, which is transported back to the very trunk of the tree. Really, our feet are very much like roots and trunks of our life, with the toes spreading out to be our roots, and the centre core of our being receiving the sustenance of the earth's stimulation, which we all desperately need. We're living in an age of stresses and strains in this 20th century fast living, and we need to go back to the very grassroots of time to understand the principles of healing and to be able to help our fellow man. Reflexology is an aid to be able to do this, and from the video which you have watched, you would have been able to learn the basic principles of the technique of reflexology. You don't have to have a vested interest in anatomy and physiology to help your loved ones and your friends. By simple procedures of stimulation through the feet on these tiny reflex points, by doing it in a loving and caring way, you will do so much good for so many people.
As we enter a new millennium, it is comforting to know that reflexology, a healing tradition from the ancient past, can play such an invaluable role in our lives, balancing and harmonizing our bodies as we step into greater and greater states of love for ourselves and for one another.